हाय, आज हम बात करेंगे कि एक फीमेल की ब्रेस्ट में क्या शेप के चेंजेस हो सकते हैं, स्पेशली अगर उनकी प्रेगनेंसी और ब्रेस्ट फीडिंग के बाद। हमारे पास बहुत पेशेंट्स आते हैं जो कंफ्यूज रहते हैं कि हमें सर ब्रेस्ट लिफ्ट कराना है या इम्प्लांट कराना है या साइज रिडक्शन कराना है। सैगिंग भी हो गई है लेकिन इतनी नहीं हुई है, तो बहुत कंफ्यूज रहते हैं। तो आज हम इस विषय पे टोटल थ्रेडबेयर डिटेल डिस्कशन करेंगे। Hi, I'm Dr. Rajat Gupta. I'm a board certified plastic surgeon working in Delhi. I exclusively do cosmetic surgery since last 7 to 10 years. And me and my team are working at Excel Hospital, CK Birla Hospital and Rosewalk Hospitals. So let's discuss in detail what are the changes a breast female undergoes after pregnancies, or what are the changes a breast female may have. Okay. So sometimes a female breast is a small breast. So they are a small breast and they want a bigger breast. Sometimes the breast becomes deflated. Deflated means the volumes becomes less. So this is a deflated breast. This is a small breast. This is a deflated breast. And these patients also want a good size shaped breast which looks like this. A third scenario would be the breast is sagging. This is a sagging breast. And for this breast, what we need to do is a breast lift surgery so that they also get a shape like this. Now, every woman would want a shape like this or something similar. These two breasts would need a breast implant surgery in which we give an incision in the inframammary fold. So, for these two patients, if this is the breast, the scar is in the inframammary fold on the undersurface of the breast and the scar is never visible. For this patient, what they need is a breast lift surgery, for which we usually do a short vertical scar technique in which the scar is like this. So there is something called as a lollipop scar. There is a circle which is around the areola, not that visible because it is at the junction of a dark and a light skin, and a vertical scar which also fades nicely over the next 7 to 8 months. We have our advanced scar protocol and we have different videos made for that. You can go and watch that, or I can discuss in detail about what we all do to maintain and make sure that our patients get very minuscule scars, hardly visible scar over the next few months. Now, this patient would end up needing this scar. This patient also has three options. They can either increase the size, they can either reduce the size, or they can keep the size same. For increasing the size, they have an option of either fat grafting or implant. For reduction in size, we do a breast reduction surgery along with the lift so that the patient gets the desired size of implant or desired size of breast. And for making the size same, we make sure they also get an upper pole fullness and nice cleavage. So we do a technique called as auto augmentation mastopexy. For these surgeries, since the scar is in the front, many women are concerned. But let me tell you, as explained, the scar will fade very nicely. If you want a good size and shape of breast and you want your breast to be lifted, you will have to undergo for a surgery. Please understand, all scars will fade with time, but a saggy breast will not lift with time. So you need to understand what are your treatment options. But for these two patients, what we just need is augmentation either by fat or implant, and you do not need any lift. I hope with this video, I was able to explain you what are the different changes in the shape of a woman's breast and what are the solutions. If you have any questions regarding these procedures, please connect with us. Me and my team are always there to guide you honestly, sincerely, and scientifically. Thank you.